dulu sebelum start. Kak Devi is marketing manager of Prixa. So Block 71 name ini Widya. Kak Widya is our hub manager, and Agustin is our internal team juga. Agustin is our team from NUS, country manager of Block 71 Indonesia. And then Gita will be help us as a host. Gita is from Wisma BNI 46, our internal team. So itu aja perkenalan singkatnya ya. Ada lagi nggak mau ngobrol-ngobrol apa nih sebelumnya? Mas Biondi sibuk apa nih? Jelasin dong tentang Jabar dulu kali ya, biar nanti bisa nggak kaget nih kita nih.
Oh, di JDS kebetulan kita emang 100% udah dijadikan crisis center untuk manajemen COVID-19-nya. So we're now doing digital service in general, tapi juga all of us are doing COVID-19 management, bagian dari gugus tugas COVID-19 di Jawa Barat. And that side of the workload is even crazier than our daily usual routine.
Oh.
Yeah.
Okay, I see.
Tapi yang partnership sama H&M buat masker segala macam itu Mas Biondi juga ya?
H&M. Oh, itu ada yang lain sih, soalnya itu non-digital.
Oh, I see.
Yeah. So we do the digital partnerships. Tapi untuk yang non-digital partnership ada tim yang lain sih.
I see.
Yeah.
Okay.
Cool. Ada tim kita juga Mas Danang, Mas Biondi. Nanti juga join jam 4 dari Blok 71 Bandung. Ya.
Oh, okay. Oh, yeah.
Kenal lah ya harusnya ya?
Yeah, I've met a few times. Sempat mengenalin beberapa mitra juga. Because what I'm doing di Jabar juga doing partnership sama project delivery. That's how we get to know Prixa.
Okay.
Oh yeah. Just for my understanding, what is the relation between Prixa and Jabar Digital Valley?
Digital service.
Service.
Our relationship. Is that what you're?
Maybe James or Mas Biondi can explain a bit.
Yeah.
Yeah. So we started out. We actually planned to have partnership on Desa Digital Kesehatan awalnya. Itu sebelum COVID-19 terjadi. And then KM requested us to have an app for COVID-19. That's how Picobar came into being. And then we were scrambling over, because he only gave us 2 days to make it.
Wow.
That's crazy, right? And then, of course, we cannot do it alone. So that's why we contact people that can support us. And for Prixa Mandiri feature, we are lucky to know Prixa a few weeks before that happened, so that we can kickstart it very quickly. And we actually managed to have it up on the production in a matter of days, like 1 day or 2.
Oh wow.
Yeah.
Wow, that's great. Yeah. That's really great. Yeah. But I think we've seen this as well, not specifically in health tech, but like a lot of things, like because of COVID, it just accelerates the way things happen. It's quite crazy. So quite interesting.
Yeah. Normally it took us like 6 months to do partnership, but with COVID-19 and with Prixa, it only took us a few days. And then with penandatanganan partnershipnya juga akhirnya remote.
Yeah, that's really cool.
Yeah, and actually we can do it in normal time. It's just this is a wake-up call for we can actually do it much faster than business as usual.
Jadi partnershipnya udah berjalan selama berapa bulan ya? Dari aku sempat lihat tuh di Instagram live-nya Pak Ridwan Kamil waktu itu yang launch-nya Picobar, right?
Yeah, Mbak Devi was there.
Iya ya, Mbak Kak Devi di situ. Iyalah, of course lah ya, Kak. Okay.
Itu juga last minute call. Datang.
Iya, kayak kita gini last minute ya.
Yeah, otherwise we had it an empty feature if we don't have Prixa on board.
Yeah.
So interesting sih Kawit, Cik Agustin dan Gita. Jadi Mas Biondi datangnya di akhir-akhir nih. Kak Devi ceritanya baru kayak 2 hari 3 hari yang lalu apa ya.
Kemarin.
Kemarin bahkan kayak Han, ayo Han, ada Mas Biondi, of course ya, kayak keren gitu, kayak ngobrol Jabar ya. Aku bilang ya, why not kan, kalau misalkan ada. Jadi kayak bener-bener wow, interesting banget, bener-bener last minute dan oke banget sih. Dan antusiasnya orang-orang yang mau join the session is I think it's quite a big number ya. Maksudnya kayak udah hampir sampai 100 orang yang join gitu. It's good news banget. Jadi orang-orang, dan I told them juga kan, James, Kak Devian, Mas Biondi kemarin tuh yang datang tuh bukan hanya dari startup aja gitu, bahkan student, terus corporate banking. I think that's good juga. They would like to know more about health tech as well lah ya, dan terutama industri yang saat ini lagi during this pandemic kan lagi naiknya ya health tech. So itu.
Just for manage, will this be in English or in bahasa?
Campur-campur.
Campur sari kita.
Sari, oke.
Ya, campur sari. Karena ada orang Jakarta, ada orang mana James, terus ada orang Jabar.
I was born in Indonesia. I can speak.
Oh really?
Yeah, sedikit bisa.
Sedikit bisa.
Logatnya masih sedikit.
Okay. Oh, so you were born in Jakarta, ya?
Yeah.
And raised in Jakarta?
No, I was raised outside.
Oh, okay, cool. Interesting. Udah ada yang
dari siapa Han?
Dari Kak Dev atau James yang mau share screen yang kemarin itu personal?
I think I can do it.
Oh, James aja. Oke, cool. Nanti aku not yet. 3 minutes. Nanti I will introduce first about our Startup Konko program, and then introduce about Block 71 Innovation Factory as well, and then introduce about Priksa and Jabar Digital Service a bit, and then I will give the session to James as well. Jadi nanti James, you can share your screen. Before you share screen, maybe you can just say hello, I'm just blah blah blah, and then kind of thing. And then Mas Biondi juga boleh say hello sedikit dulu di awal. Nanti kan yang akan presentasi pertama it's James, right? Jadi nanti setelah presentasi yang udah kemarin kita terima slide-nya itu, nanti aku akan lead the session juga. Kalau misalkan udah selesai the presentation, I will maksudnya memulai the Q&A. So James and Mas Biondi, both of you guys can mulai juga jawab pertanyaan-pertanyaannya. Since on our tour juga kan ini kalau tour yang aku punya untuk periksa ini kan lebih ke periksanya ya Mas Biondi ya. Cuma nanti sepanjang perjalanan the session pasti kan ada juga yang pasti nanya tentang Jabar itu kan. Dan memang kita mau discuss more about Picobar ini kan gitu. Jadi kayak paling nanti untuk teman-teman yang akan join, mereka bisa tanya di group chat. Nanti hostnya kita bisa bantu kalau misalkan dia mau ngetik doang, nanti aku yang bacain. Tapi kalau misalkan ada yang kurang jelas, we can ask them to unmute. Jadi mereka bisa langsung nanya juga kayak gitu. Misalkan ada beberapa pertanyaan yang interest dan kayaknya kurang jelas atau mau gimana, biasanya gitu nanti kita unmute mic-nya, nanti mereka yang bisa langsung nanya ke kalian juga, James and Biondi kayak gitu ya Mas.
Oke.
1 minute left. 1 menit lagi gengs. Wow, gitu udah ada yang masuk gitu? Belum ya?
Ya, yang waiting ada 24.
Oke, waiting. Udah langsung bisa kita persilakan kali ya sekarang ya?
Ya, nggak apa-apa.
Waiting guys, oke kita. Ya.
Oke, I'll mute myself. Good luck guys.
Thank you.
Thank you.
Hello.
Halo. Okay. Alright, so welcome guys to our Startup Konko session. While waiting the others to joining the session, aku mau say hi dulu ya. Hi James.
Hi.
How are you?
Good. How are you?
Good, thank you. How are you?
Very good.
Cool. Hi Mas Biondi, how are you? Apa kabar Mas?
Baik, how are you?
Baik, oke. Wah, gimana nih? Ada yang puasa? Selamat menjalankan ibadah puasa dulu ya sebelumnya. Yang nggak puasa juga nggak apa-apa ya. Selamat menjalankan ibadah puasa, tetap semangat WFH-nya, walaupun di rumah aja. Dan thank you juga teman-teman yang udah join. Thank you for joining sambil nunggu yang lain. Welcome to our Startup Konko session. Let me introduce myself first. I'm Hannah. I'm community manager of Blok 71 Jakarta. So this session, we call it as a Startup Konko Online. Basically, Startup Konko is our monthly program. So we invite the startup founders to share more about their experience and then about their knowledge, about, like this session, we have Priksa.ai. So we have James as a CEO and co-founders. And we have Mas Biondi as a head of implementation of Jabar Digital Service. So we are going to talk about what is the health tech role, especially in this COVID-19 pandemic. So I think that's a bit introduction from myself, guys. Right now we already 4 p.m. So we are going to start. Yeah. Just prepare yourself while waiting the others. So this session we will conduct on Bahasa and English. Since James also can understand about Bahasa, but you can also use English, guys. And the rules of the session: please turn on the video, your video, but still mute your audio, yeah. And you can also ask any question to James and Mas Biondi on our group chat question. Later we will read your question, and then James and Biondi also can have to answer your question. Or if there's something we need to ask you more, we will unmute. We have host here, Gita. Gita will help for the mute and unmute. Okay, cool. Yeah, it's okay. Yeah. So yeah, James, now your turn.
Great, thank you, Mbak Hannah, for the introduction. I'm very honored to be at this webinar to introduce Priksa, to see what we're doing, and kind of explain kind of like the progress we made. I'm very happy that Mas Biondi was able to join last minute. He is head of implementation of Jabar Digital. One of our biggest projects is with West Java province, and I'm happy to be sharing this webinar stage with Mas Biondi.
Yeah.
Thank you for having me. Happy to share as well.
Cool.
So without further ado, let's jump right into it. Can everyone see?
Yeah.
Okay. Okay, so what is Priksa? Priksa is, we like to think of ourselves as a healthcare startup looking to really disrupt the insurance industry. So we were actually one of the first AI-based healthcare management platforms with really 2 components: health insurance, or at least the back end of it, health insurance, as well as AI diagnosis engine. And really, what we are at its core is an AI company that really is found a niche in healthcare. And one of our mantras of why we chose AI in healthcare is really scalable access. And I really want to bold that term, and because I'll keep referring to it. It's the scalable access to healthcare and health education. And what we've done was really taken our diagnosis engine and compile it with many different forms of the healthcare ecosystem, as you would find in the offline. So a customer journey offline healthcare would include doctors, scheduling, information, lab, pharmacy. And we try to combine that all in online, as well as put AI technology behind it. And really, the big picture about it is how do we then assess healthcare, and how do we make it accessible in both access, actually being able to go see a doctor and receiving healthcare, as well as access includes affordability and being able to pay for healthcare. And really, that's kind of the foundation of what we are at Priksa. And I really go back to really what is our core strength, and it's AI. So we really took AI and leveraged it for healthcare. And what I mean by that is we deconstructed the thought process of doctors and repackaged it up into a very scalable platform. And, you know, I actually am trained professionally as a doctor. And in medical school, you are taught the basic history taking for a doctor. So when you go see a doctor, you come in with a chief complaint or keluhan, and a doctor basically says, asks the same, more or less the same structured questions that you would. And in the mind of a doctor, based on how you would respond with onset, with characteristics, they form a differential diagnosis in their mind, and then they give you advice. And we've taken that capability and tried to put it in this, this platform we call Prixa. And it's leveraged on artificial intelligence. And this is what we believe is scalable in that we can put the mind of a doctor essentially anywhere that has internet and hardware to do it. And our platform is very user-friendly, and it's very it's catered to the general public of Indonesia. So all Indonesians can actually use this as if they are trying to find, or as if they're trying to talk to a doctor, or at least tell a doctor about their keluhans. And really the end goal of our platform is this results page. And it's really the function of what we want for AI. We use AI to really empower the users to make an impactful healthcare decision. And I really, that's kind of the result that we are looking for, is empowerment of the users. And so if a user uses Prixa and they decide that their keluhan, they want more information about their keluhan, they're able to talk to a doctor. And one of the ways that we do it is we run a small telemedicine consultation platform in which we serve insurance companies as well as other stakeholders. And really, we are able to show that not everyone that comes on and talks to a doctor needs to go to the offline facilities, which really, in this time of COVID, really lightens the load, or at least offsets some of the load to really do symptomatic management at home. And with teleconsultation, as well as AI diagnostic engine, we're able to filter out people that don't need to go off to the offline clinic or hospital to get care. But if they do need to get care, we do have scheduling, make it accessible, readily accessible for them to go to the clinic. We do have the content, which empowers the users to really self-educate, as well as empower them to do symptomatic management at home, as well as other parts of the healthcare ecosystem, such as pharmacy and laboratory, that we are able to cater to really the changing times, as well as convenience, as well as offset some of the costs to the healthcare payers, as that we refer to at the very first start of it, the healthcare payers. And the next step for this whole system is being able to put it inside the entire ways to make it accessible, which is online as well as offline. And online, we have our partnerships with other healthcare ecosystems. And offline, we have our partnerships with corporations, as well as partnerships with the government, such as our partnership with Jabar Digital. And this is a great segue into having Mas Biondi explain a little bit more about what Jabar Digital does in terms of healthcare, especially in light of this COVID pandemic.
All right.
So yeah, Mas Biondi.
All right. Okay. So yeah, thank you for the introduction, and we are very grateful and happy to join this discussion as well. Pretty much because government in COVID-19 management is not going to be able to manage this whole pandemic by itself alone, just by governmental officials. We definitely need support from communities and startup founders and startup companies, and those who have already been developing solutions that can immediately be implemented in this difficult situation. Just a little bit of of introduction about Java Digital Service. So it's a newly founded digital delivery unit by the governor of West Java, Ridwan Kamil, or often called as Kang Emil. He's one of the celebrity governor, if some of you are not from Indonesia. But so he has this idea that public service needs to be accelerated and accessible through digital technology. And the momentum with COVID-19 is definitely an accelerator for all this technological implementation. So initially, we've been in communication with Priksa a few months before COVID-19 happened. So we were talking with Priksa about the possibility of having teleconsultation or telemedicine in villages. So we have digital village program because 70% of West Java demography is in village. We have over 5,312 villages, all of which, of course, need access to healthcare. And then our numbers of healthcare facilities and caretakers are definitely not enough, and the spread is not well spread across all these villages, and therefore we are looking for ways to serve them through digital technology. We can explain about the challenges that we have with digital technology serving in rural areas, but then we haven't been able to really implement that until COVID-19 happened, and then we were requested to make an app that sort of gather all the information about COVID-19. We got quite a few features in that. And one of the requests that Kang Emil has, the governor, wants us to do is to have self-assessment for our users, this is the first step for them to know whether they have high likelihood of having been infected by COVID-19. So we were looking at our list of partners and and we were only given 2 days to make that happen. And we started right away to contact James at that moment and Priksa team, and then they, at a heartbeat, I guess, decided to say yes, and then they wanted to come on board and join our effort. And then in 2 days, we had it launched in the command center in Bandung, and we got thousands and even hundreds of thousands of people doing self-assessment, which is very helpful because we during COVID-19 period, our healthcare facility is sort of offers stretch. They are unable to cater all the needs. This sudden exponential growth of positive cases and those who think that they might have been infected were rising exponentially, but not all of them are actually needing to go to hospitals, and that's why teleconsultation is very helpful in that sense. I think I can certainly explain more should any questions arise, but that was the start of our partnership, and which is quite unique because usually we do 6 months assessment for a partnership to come into implementation, but with Priksa we only needed like 2 days for that to come into being, and then which is what we expect and hope for other startup partners which are wanting and willing to help the government to serve public needs and solve problems in general. Yeah, I'll give it back to James if you wanted to continue.
Sure. Yeah, I was just going to go a little bit, kind of show a little bit about what we are doing with Java Digital. One of, like what Mas Biondi had said was, how do we screen patients? How do we get patients information of whether they have a high likelihood of having COVID or a low likelihood of having COVID? And one of the questions that we wanted to answer was, how do we prioritize COVID screening tests in West Java? And I think that was really one of the paramount questions that we wanted to leverage our platform in actually helping the government of West Java actually execute. Given that there's not a lot, 50 million people living in West Java, you can't screen everyone for COVID, everyone who has a fever with COVID. There's just not enough screening tests. But what we were able to do was really partition part of our engine out and really tailor it towards COVID and COVID symptoms. And we had a team of doctors really go out there and do the research and do evidence-based medicine on how and what are the risk factors that leads to a doctor saying that this person has COVID as well as, or this patient doesn't have COVID, or this one has a higher likelihood of COVID than this. And then we took it to the next step of these are the risk factors that end up having a higher mortality rate. And those were really the patients that we had proposed to West Java to really test, because at the end of the day, if you're really talking about how to flatten the curve, right, it goes back to the concept of supply and demand of ICU beds and ventilators. How do we get the sickest patients into the hospitals, or how do we get the patients that have the highest likelihood of becoming really sick into the hospitals? And we were able to effectively do that with our COVID engine, which, using the same fundamentals of scalable access to healthcare, we were able to implant it in Pico Bar and have the actual engine ask questions as if it were a doctor asking a patient in an outpatient setting about the symptoms: how long, what fever, yes, no, how high, any contact, any other symptoms, as well as some of the other risk factors: age, chronic disease, the list goes on. But it really shows that with technology, you were able to really scale as well as leverage the scalability. And as long as you incorporate evidence-based medicine, you're able to effectively screen a population at large. And really how it works is how I just explained it. Patients enter their user information, their symptoms data. Our engine basically analyzes the way that you answer your questions, the symptoms, the risk factors, and it gives you a predictable predicted possibilities of what could be causing your symptoms, because not everyone with fever has COVID, but even though 90% of people with COVID present with fever. So it takes a lot of knowledge in experience in medicine to actually tease out which are the patients that actually have COVID, or at least have a high likelihood of COVID. And we took it a step further. How do we predict and risk assess someone who has a higher chance of mortality to really get tested and trying to filter them into the offline segment? And really from there, you have symptomatic management at home with self-medicine and self-isolation and rest. Or you can actually go into the consultation with our 119 hotline, or even in the pipelines telemedicine. And like Mas Biondi pointed out, we have over 1 million visitors to the actual engine itself. And last I was told, it was about 30 to 50% of Pico Bar users actually utilize this Priksa Mandiri feature, which actually shows that this is actually a good feature that we can actually give back to the residents of West Java. And from those users, we were able to isolate and identify about 5 to 10% of them who fit the criteria of being able, or at least fit the criteria to be screened. And we passed that over to West Java. And really the result of it, really, we are able to, provide impactful protocols for West Java, scalable access to healthcare, and really a centralized, reliable source that we were able to give back to West Java's, the province of West Java, as well as the residents. And really, it's really from these humble beginnings that we can actually, potentially set the stage that this is an actual great model that we can implement on a nationwide scale. That's kind of where we are with Priksa, as well as West Java and Java Digital.
Okay, cool. So yeah, so that's about partnership between Priksa and Java Digital Service. Maybe Mas Biondi from your side. Within this pandemic situation, right? What is the main thing? Also, we received the question already from the participant as well, Santos Nair. How do you educate the rural population in using such tool, and also to trust the power of telemedicine and teleconsultation? James and Biondi.
Right. Okay. So yeah, it's definitely a great challenge for our overall vision to transform West Java into a digital province. But the effort has gone way before COVID-19 happened. As I've mentioned, we have this digital village initiative to help rural population, rural areas to tap onto existing solution. The problem with digital technology and implementation and acceleration is the fact that it might also widen inequality in general, because you need a certain threshold to be able to access that technology. In the case of telemedicine, you at least need to have a device. You also have to at least need internet connection. And with this kind of awareness, way before COVID-19 management happened, we had two programs for Desa Digital. We assessed that there are over 771 villages that still do not have internet connection, even cellular connection. Some of them have phones, funnily enough. So usually they use their phone, they go into another village that has internet connection, they download their content and then go back to their respective villages and consume the content then. But you cannot do that with telemedicine because it has to be streamlined, it has to be real time. So we understand that even when people have devices, so generally smartphone penetration is quite high already in West Java, even though it's rural areas, but the connection is still problematic. So with that 771 villages, we work with the central government, Kominfo. They have this unit called Bakti, and they have a program to provide visit facility, very small purchase terminal, to provide internet connection to all these villages who are still in developing stages, so with their index Desa Membangun. So with that, we are able to cover over 400 villages in the time span of 1 year. We were planning to complete the mission this year before COVID-19 happened, and then suddenly everything has to come to a halt for the moment, but hopefully we can continue when this is over. So that's one of the things that we're trying to make sure. So facility infrastructure has to be present in villages. And then it's not enough to have infrastructure to be installed. We also need to, as you've mentioned, educate people to be able to use it. So another program that we have is called Sapa Warga, which is a program that we do with community leaders, which is Ketua RW in Bahasa Indonesia. We have over 52,000 community leaders that we are engaging with. Hopefully, with our mindset is that these will be the proxy of communication that we have in community level. Of course, it's not realistic to expect community leaders to go around and educate everyone. But at least in that scenario, at least we have one person that we can sort of hold on to whenever we wanted to whenever we wanted to socialize our programs and policies, including teleconsultation and telemedicine. We also work with a lot of communities in the grassroots as well to help people use the products and the tools that we sort of deploy. And Sapa Warga is not only about application, it's also giving these community leaders with gadget. At least now they have a gadget with front camera for them to be able to use teleconsultation, for example. And then it also comes with a top up for their pulsa, for their data package, because a lot of these people might have issue with that as well. So yeah, we sort of think through what they need in order digital transformation be able to actualize in their places. Our bigger mission is whenever we wanted to pursue digital transformation, we wanted to make sure that people are not left behind, that even those who are living in rural areas can still catch up with the threshold for them to be able to use this technology.
I see. Cool. Thanks, Biondi. And James, you want to add something about this?
Yeah, absolutely. I just like, you know, from a startup point of view, it goes back to really partnering with the essential stakeholders. And definitely, you know, the government is one of the major stakeholders in providing healthcare to the rural population. And I'm first to admit, without them, you know, it's going to be very hard to educate, but, you know, it's also a challenge that can be overcome with, you know, the right stakeholders in the same boat, heading towards the same cause. So it's definitely, it's not one player that can take it all, or one pair that can educate everyone, but it's actually getting the right stakeholders to really go towards, pushing the education of telehealth, teleconsultation, telemedicine.
Okay, cool. So yeah, based on your presentation, James, can you please explain about health tech landscape in Indonesia?
Yeah, definitely. Health tech was a booming industry even prior to COVID. You have a lot of health tech out there, a lot of telemedicine, and it's definitely Indonesia has the right ground for that. If you really look at a macroscopic level, it's the largest population, and it's and 60% of the population is under 30 years old. You have a growing middle class. You have an increased penetration of digital, connectivity. Those are like really the ripe breeding grounds for actually a booming healthcare or a booming technology sector. So not particularly just the healthcare, but all sectors across Indonesia, at least, were booming in the terms of tech. But in particular, healthcare and health tech, it is definitely a very broad sector. You have people from the payer side all the way to the provider side, people from giving teleconsultation to delivering pharmacy, delivering laboratory, scheduling. Each individual, patient journey, if you're looking at health tech, is a startup on its own, is a whole industry, whole company, because they can go really deep into each individual points along the way of the journey.
Cool. Okay, very nice. So yeah, before we continue the Q&A session, guys, so welcome to our Startup Konko online. You can drop your question to our Zoom group chat. So also our host can unmute your audio if you want to explain more about your question. Okay, so we have the question already, James and Biondi. James, how does the AI engine assure false positive or incorrect decision? There cannot be 100% decision done by AI, right?
That's a great question. I believe that there's a stigma behind AI, especially in healthcare, to really not rely totally on healthcare. But the way that we had built Prixa, or at least built our engine for West Java and as well as for Prixa itself, was really to be a screening tool. And if you really look at screening tools in itself, it's not about false positive. It's actually, by definition, for a screening tool, you need to limit the false negatives, right? To be a good screener, you need to be able to limit the false negatives so that you can usher those people to get more specific tests. So then you're talking about specificity. So the way that we position Prixa and its AI is not to be 100% correct on false positives, but it's actually to limit the false negatives so that the offline sector or the more specific test can actually be implemented. In this case, it would be the rapid screening test, which in itself is a screening test in by itself. So even then, that is subjected to false positive as well as false negatives. But then you go on to PCR. So there's really a stepwise progression that that AI has. We err on the safe side of trying to screen, and our goal at Prixa is to really limit the amount of false negatives so that everyone can actually, or at least people who have concerning symptoms, can be ushered to get more specific testing done.
Got it, cool. Okay, so hope Santos Nair can, you can satisfy about the answer, right? Okay, guys.
Thing to add as well.
Maybe Mas Biondi can add something.
Yeah. So what we found very interesting as well with our partnership with Prixa is that right after implementation, the functionality of this feature that we have on Picobot also evolved over time. So at the first time we launched the feature in the product, it was essentially just for self-assessment and screening for each of our users. And then later, as the COVID-19 evolved and the stages getting escalated, we have the urging needs to have people tested, as many of them as possible. But the problem is that we have very limited amount of testing kits available at our hands. At the moment, I think we only have a few, like 30,000. Right now, I think we have over 100,000. But then when that was started, we sort of only have very limited amount of test kits. And the question is that how do we determine which one need to be tested and which one can be ruled out? Obviously, we have these PDP and ODP that we can directly test, those with symptoms. But there are a lot of random samplings or a lot of people out there who might already got infected, but we are unable to reach out to them and they're unable to reach out to us as well. So we requested Prixa at that moment to be the first stage of screening for people to come to Picobar and explain about themselves in a way they could input their identity and then their symptoms, and also, interestingly enough, their contact history. So we sort of give them a few options, and whether they have been visiting or whether they are involved in certain clusters, because by then we've already been able to identify a few clusters where the spread was relatively more massive than the other places. By then we could sort of filter it down to even a lesser number of people, and therefore we have a more targeted strategy when it comes to massive testing. And then, but your question on false positive, and I think I echo James as well on that, because right after that, then we send them to do a rapid testing with RDP, and then if it's confirmed reactive, then they'll do a PCR. Which helps us narrow down the option as to whom this server need to get tested.
Wow, cool, guys. Very insightful. So in terms of the future trends, guys, James and Biondi, what is future trends do you think will happen during this pandemic, after this pandemic? Future trends do you think will happen on the health tech industry? Maybe James or Mas Biondi? We cannot hear you, James. Hello.
Sorry. So definitely healthcare in itself has been really tested by this pandemic, and the front line has been doing a great job at being the miracle workers for it heroically, right? I believe that there will be a new normal that will make the old normal look completely like distant, because if we really think about it, right, there's going to be new trends, especially in the healthcare, looking at just healthcare in itself, like different habits, like maybe social distancing might be the new normal. Face mask, not using face masks just for pollution, but actually for health reasons, right? Then you have like really the online platforms, the way that are delivered of healthcare, right? Can we take the gatekeepers of medicine, which right now in the national healthcare scheme is the GPs at the Puskesmas, but can you move it one step upstream on the digital side of it? Can the digital telemedicine or the digital line of healthcare be the first gatekeepers to the offline segment? There's a lot of changes that I foresee because of this healthcare or this pandemic, and it's very interesting to kind of look forward to. I'm very excited and also quite not scared, but definitely trying to plan for the future. I think exciting times ahead.
Oh, wow, cool. Mas Biondi, want to add something? What do you think about future trends of the healthcare industry?
Yeah, just a quick one. Well, I think a pandemic like this is a blessing in disguise, because we've been wanting to do this a long time before COVID-19 happened, right? And then once this happened, we suddenly have reasons to sort of advocate for this for more people even, and then people are more receptive, because some of them do not even have options other than what they can have with Picobar or with Prixa directly. So yeah, I think this pandemic really, even though this is bad, nobody really wants this to happen. But then there are positive things that we can leverage from it. One of it being teleconsultation, and seeing the trend, I think when people started to see what they can get out of it, it's easier because I think the phases for user acquisition is sometimes to really try to talk to people and then convince them to try the product first. I think that's one of the biggest challenges now that people starting to try it. I think it's also our job with startup healthcare startups and the government to really be able to serve them well with a good product so that they can stay and the user retention could continue even long after the pandemic ends.
Got it. Okay, so guys, we have an interesting question from Ramos Arwan. Guys, related with COVID-19, do you have any idea to integrate your AI concept with our ITS UNER COVID-19 robot facility in Surabaya? It's called Raisa, a robot that replaced nurses to serve COVID-19 patients in hospital in Surabaya. Maybe this question is for our CEO, yeah? James.
It sounds like a very interesting product that you have there, a robot to replace nurses. I'm assuming it's like an AI nurse, like on a platform, and not like an actual robot going around. But I think that's fundamentals of medicines will always be fundamentals, right? How do you take really the thought process of any healthcare worker and really package it up into like technology and engineer it into a platform? Definitely, it's worth exploring. I think it goes back to your original question of what are the future trends of healthcare in the future, and this is one of them. I think that we might see robot nurses, robot doctors in the offline hospital. We just never know. I mean, that's uncharted territory that we're going on, and I think that it's exciting to see the innovation. And just to mirror what Masbiondi said, this COVID-19 is really a blessing in disguise because innovation is coming out of this, at least in the healthcare industry.
Okay, cool. Yeah, maybe Ramos, after this session, you can separate about this Surabaya robot. It's cool. Okay, so we have a question from Agustin. Tokopedia and Bukalapak data breach exposes the vulnerability of personal data in online platform. How do you ensure our data is secure to mitigate the potential privacy risk in telehealth? James and Biondi.
Absolutely. At least from our standpoint, from a Prixa standpoint, we regularly go under a penetration test. So we actually encourage a third party to actually try to penetrate us and simulate a security breach. So we do our corporate due diligence to actually ensure that our system is 100% safe. It can never be 100% safe. First to believe that if there's a will, there's a way. So we always have to find a way to at least find all the vulnerabilities and actually make patches or make remedies that doesn't happen. I'm sure that the West Java has something in place that I'd love to hear Masbiondi what you guys do for data security.
Yeah, it's pretty much the same thing. We also have penetration tests for every application that we launch. The ICT agency has a certain division that is dedicated on that. We have a Kabit, Kepala Bidang, and pretty much his team to do penetration tests for all the products that we made available in the public. But even with mature startups, it might still be able to happen. But we are pretty much aware of that. And even the healthcare department in West Java is always advocating for data privacy, even though they are coming from healthcare sector. And we've seen this happening with COVID-19 as well. There, especially in the beginning of positive cases being discovered first in Depok. Apparently, the leader sort of announced the names and where they live, and things go really bad afterwards because people are generally not prepared in terms of how to treat people discovered with positive cases. So there are a lot of stigma stick to them, and then which is something that we sort of feel sorry for, because COVID-19 is just like another diseases. I mean, you can have you can know your friend having positive cases, but still be friend with them without touching them. Of course, definitely. There should be there should be a physical distancing. But in our side, for the government, specifically on COVID-19 cases, there are regulation actually to sort of disclose the data by still protecting individual privacy. So in our case, we actually intentionally publish at least within the village or kelurahan level if they're living in the city. The intention is for the neighborhood to be more aware of the presence of positive cases in their neighborhood. But we still respect personal data privacy in the sense that we don't disclose their names or their exact address. So we sort of pointing the neighborhood, the boundary of the neighborhood, without necessarily pointing to their houses. This awareness, unfortunately, isn't applicable to all governmental stakeholders. We've seen many breaches of this happening, be it in central level or in city and regency level. But in the case of our team, we are pretty much aware of having to be careful with data privacy and protecting data privacy all times, and we do take steps towards ensuring that our data is secured.
Okay, I got it. Cool. Hope Agustin, yeah, I think the answer from James and Biondi satisfied about the data. Okay, Biondi, regarding the Jabar Digital Service, ini karena tadi udah bilang bilingual ya, bisain bahasa in English ya guys. So yang join please do not hesitate, boleh nanya. Kalau tadi mikirnya wah bahasa Inggris semua nih malu-malu, langsung aja boleh di grup chat pakai bahasa Indonesia atau pakai bahasa Inggris ya guys, boleh banget. Nah untuk Mas Biondi regarding Jabar Digital Service, tadi aku baca-baca nih di berita nih untuk PSBB di Jawa Barat sendiri mulai tanggal 6 Mei, right?
Yes, today.
Ya, if I'm not mistaken gitu, 6 Mei. Dan sebelumnya udah dimulai dari Bandung Raya dulu ya, sebelum akhirnya dari Jabar mulai. Ya. Nah, how Jabar Digital Service help the PSBB situation di daerah Jawa Barat ya khususnya, walaupun udah dimulai dari Bandung Raya dulu. Dan menurut berita juga kita baca terjadi angka atau penurunan angka ya Mas ya sejak diberlakukannya PSBB itu sendiri. Nah dari teman-teman Jabar Digital Service, can you explain more ya about the experiences untuk membantu nih penurunan angka COVID itu sendiri?
Yeah, sure, definitely. Jadi PSBB di Jawa Barat, so I'm answering in bahasa, right? Kalau PSBB di Jawa Barat itu sudah dimulai per tanggal 15 April, dimulai dari wilayah Bodebek dulu, jadi 5 daerah Bodebek. Kemudian disusul 1 minggu setelahnya di tanggal 22 April di wilayah Bandung Raya. Jadi total ada 10 kabupaten kota yang sudah memberlakukan PSBB. Okay. Nah per hari ini diberlakukan secara provinsi. Jadi keseluruhan provinsi ini mungkin salah satu yang pertama di Indonesia setelah Jakarta, which is obviously a special case. Dan how we help this process happen, there are a few things, I think there are 3. Pertama terkait data, transparency. Jadi keputusan dan kebijakan yang diambil selalu berdasarkan data.
Right.
Pada saat kita memutuskan harus melakukan PSBB di daerah Bodebek, itu karena kita juga lihat data positive cases yang sangat eskalatif waktu itu, termasuk tergolong red zone. Dan pertambahan cases hari demi hari sangat banyak. And therefore we were confident that we need to do that there first. Dan seminggu setelahnya disusul di Bandung Raya karena juga pertambahan kasus dari data-data yang kami dapatkan. Memang red zone kedua tertinggi di Jawa Barat itu ada di wilayah Bandung Raya, kota Bandung dan sekitarnya. Okay. Tapi setelah itu sudah banyak terjadi local transmission. Kemudian ada banyak kasus pulang kampung, mudik. Jadi sekarang hampir semua daerah kecuali Tasik waktu itu yang masih 0 positive cases, itu semuanya sudah random, sudah tersebar, kita udah nggak bisa kontrol hanya di daerah red zone saja. Jadi akhirnya diambillah policy yang berdasarkan data tadi untuk menerapkan PSBB di Jawa Barat. That's the first point. Untuk poin kedua, konsekuensi dari penerapan PSBB adalah harus diadakan massive testing yang lebih massal lagi. Dan semuanya berdasarkan riset dan tools like Priksa screening is also helpful for us to determine where to test, how much to test, how many tests do we need, whom to test, stuff like that. So we are preparing to do over 1,300 tests per day. Currently, our bottleneck, our capacity is about 1,000 per day. So we are pretty much reaching the ideal test amount that we need per day. Dan tes ini memang sangat kritikal karena percuma kita PSBB kalau kita tidak berhasil mengidentifikasi peta penyebaran kasus-kasus COVID-19. Dan penyebaran ini tidak akan ketahuan tanpa adanya tes. So Jabar Digital Service help accelerate this process of massive testing. So we use QR codes to invite them and come over. The people would on the field would just scan the barcode and we would immediately get the information whom is coming and whom is not coming. And then right afterwards, they would be able to get the results from their mobile phone as well, whether they are negative, tested negative or positive. And then we also provide, which is also done through Priksa, they would be able to read sort of the advice of what to do when they are tested negative and what to do when they are tested positive. Because even there are a lot of asymptomatic cases with COVID-19, jadi udah positif tapi nggak ada gejala sama sekali. And they can definitely do home care and home isolation in that case. Jadi nggak perlu sampai datang ke vaskes. So that's the second thing, second point that I wanted to make. Third one, konsekuensi dari PSBB ini adalah bantuan sosial. Karena ternyata banyak sekali orang-orang yang akhirnya kehilangan pendapatan atau berkurang pendapatannya, ada yang banyak bisnis yang merugi juga, dan ada PHK massal. Jadi pemerintah juga menyiapkan bantuan sosial untuk meng-cover orang-orang ini, which is also helped through digitalization, termasuk untuk data verifikasinya, kemudian termasuk untuk menampung aduan-aduan yang masuk. Karena ternyata bottom up data, we still do bottom up data, tapi banyak yang tidak tercover lewat physical verification. Jadi dengan adanya teknologi yang disediakan lewat Sapa Warga maupun Picobar, orang per orang bisa secara langsung reach out to their government and tell us whether they need to get help or not. The third one is not pretty much it's not very related to healthcare, but that's what we also do when it comes to PSBB.
Okay, wow, interesting ya. Jadi tadi ada 3 poin ya dari Mas Biondi. Okay, so untuk James nih ada pertanyaan dari Riandri Lowell. What could AI achieve more in 5 to 10 years in telehealth, James?
Yeah, absolutely. I think this is a interesting question. I think the sky's the limit with AI, right? How it just is a matter of how much data that we can get and what are the use cases that we can really what are the use cases that we want out of AI, and potentially AI I don't think will ever replace a doctor. I think it's not meant to replace a doctor. It's meant for doctors to become more efficient, to be more standardized, and to help their workflow out as well. But AI could be be used to target therapies based on genetics. It could be screening for potential long-term chronic illnesses before you even get it, right? It's just a matter of how much and what you are willing to work for, or at least put the data that you have to work, right? It could go from the provider side all the way up to the payer side. How do we risk assess people better for health insurance? How do we point people in the right direction of which hospitals or which doctors have better outcomes based on AI, right? And the sky's the limit. It's just a matter of what are the use cases that you think that will help the healthcare industry out, and if we have the data to kind of support those tools to be made. I think it's a difficult question to ask, but I think at the same time, we're all thinking ideally that AI could one day, replace doctors, but that's really not the case of AI. It's really to really augment doctors' thinking and as well as their workflow.
Okay, got it. Cool. So yeah, kita juga bisa lihat di sini ada pertanyaan juga untuk Mas Biondi, tapi ini lebih ke govern and assure data privacy. Tadi udah sempat kita bahas juga ya Mas Biondi. Or you wanna add something lagi untuk Santos, pertanyaan dari Santos? On personal data as well as health records of the citizens. Gimana nih Mas Biondi? With so many telemedicine tools out there, how do you govern and assure the data privacy?
Yeah, I think it goes back to my initial response. It's a great challenge, and I think it would become an even bigger challenge with more people joining online teleconsultation. But we do our best. We do penetration tests every time a product is launched, and then it's also important not just for the IT team to be aware of it, but also the health department to also be aware of it, because of this data, we call them the Wali data. So they're still the Wali data. So we are the only one who, we are just serving as the data warehouse, so to say. But if the people are not sensitive about this, then they might as well sort of disclose the information even without hacker coming to their system. So we are doing these efforts as well to advocate for data security with our health department.
Cool, thanks Mas Biondi. Okay, to James dari PPP or PPB. Interesting question. James, how confident are you to compete with teleconsultation? Because as I know, the mindset of Indonesian still trust consultate with real doctor, since Priksa use AI or robot. Wow, that's interesting. James, please.
Yeah, absolutely. Another interesting question.
Yeah.
To be honest with you, I'm not confident at all, right? But the reason why I'm not confident is because I don't want to compete with telemedicine doctors, because at the end of the day, if you know, I can revert back to what I said, it's AI is really not there to compete. It's not there to replace. It's there to really empower the users to make an impactful healthcare decision, right? And if we can actually do it in a scalable way, that's what our end goal is. How can we get healthcare accessible to everyone at a very minimal cost and ensure great accuracy? So in a way, we don't want to compete with telemedicine. And at the same token, we believe that even telemedicine has its shortcomings, right? Because there's telemedicine won't ever, I don't think it will be hard pressed to replace an offline doctors, because how do you replicate this face-to-face interaction, right? So this webinar is a perfect example of that. It's like we're having this webinar over a digital platform, much like a teleconsultation, but it's just not the same feeling as if this was at an actual event space where you and I are having a conversation, there's an audience. It's just not the same. It's just hard to replace that human element, that empathy that you can actually express and feel when you are face-to-face in the same setting. So again, it goes back to my original statement. We're not there to compete. We're not there to replace. We're really there to empower the users to make an impactful healthcare decision.
Wow. Interesting answer from James. All right. So regarding this question, I have a question from my side, our side. What makes Priksa different from the competitors, such as Halodoc and Halodoc? James.
Again, it's definitely, I don't like to compare. I think that for us, we just want to focus on how do we get scalable access to medicine or scalable access to healthcare. And we do it in a way that is, in the end, very scalable, right? We go back to really what are the challenges of Indonesian healthcare system, right? The WHO published a report that said Indonesia only has 1 doctor for every 4,000 population. Yes, that is probably more distribution issue, but the root problem there is how do you get doctors, how do you get the ratio down to 1 to 1,000, which is the recommended ratio from the WHO. You can either produce more doctors, or you can actually leverage technology to actually decrease that gap, or at least artificially lower the gap, because they can handle more patients as well as handle patients more efficiently. And so for us, we go back to our root core, which is AI in healthcare, and how do we leverage this technology and data to really empower the users and make healthcare more efficient.
I see. Got it. All right. Wow, very interesting, insightful for us ya guys. So yeah, you can also drop your question ya guys yang joining. Di sini ada kurang lebih 58 participants. Wow, cool. Bisa langsung tanya di our group chat. Yeah, and for Mas Bionde and James, in Priksa and also Picobar apps, right? Itu kalau nggak salah ada yang namanya Priksa Mandiri, right? Nah, can you guys please explain more about what is Priksa Mandiri? Kayak orang, misalkan aku ngerasa batuk-batuk, or aku ngerasa punya demam tinggi selama 3 hari berturut-turut. Nah, bisa jelasin nggak sih, se-efektif mana sih fitur Priksa Mandiri yang ada di Picobar itu sendiri? Maybe Mas Biondi, your turn.
Right. Sure. So Priksa Mandiri is exactly the feature that we are working together with Priksa.
Yeah.
And I think the name also sort of comes from Priksa's name, but with Mandiri attached afterwards. What we found interesting with Priksa is not only being able to tell whether a patient has a higher likelihood of getting COVID-19 or not, but it can also suggest what are the alternative disease that you might get infected at that moment. So I think with our options at that moment, it was the results would be likely yes or no for the patients, right? For our users, that was the alternative that we had. But for Priksa, it's not only giving you a yes or no answer, but it also gives you all this variety of likelihood that you might have, which again we can also test it afterwards. So it gives you that extensive options that can come out of the consultation, and then afterwards they can sort of opt for whether to get tested, or they can also opt for direct consultation with actual doctors and doing it sort of remotely. Yeah, so for those of you who have not installed Picobar in your phone, well, if you are in West Java, definitely it's a product to try. It's now on both Android and iPhone. But if you are not in West Java, unfortunately, it might not be for you, but it's also good to compare and probably to show to your government that it's something that can be done with startup partners.
Okay, cool. Alright, so ada pertanyaan dari Devi. Apa rencana Priksa sendiri dan Picobar sendiri setelah COVID-19 berakhir? Apakah akan ada kerjasama lagi ke depannya? Wow.
Jam berapa?
Jam 5.
Sorry, boleh tolong di-unmute, hostku?
5 menit.
Yeah, thank you. Okay, Mas Biondi and James. After this COVID pandemic, ya kan? What guys do you think about the partnership between Priksa and Picobar as well?
Yeah, definitely we are very much looking forward to the end of this whole hullabaloo. Yes, we definitely wanted to get back to our initial plan to introduce more of this to rural population. We have digital village for healthcare waiting in line already. And a bit of explanation about digital village program that we have. So it has sort of 3 layers towards that. So as I've mentioned before, we introduce infrastructure, internet connection for villages, and in the second level, we sort of wanted to empower them with digital literacy program. And then in the third level, we sort of wanted to escalate the process of technological adaptation, but it really depends on the economic potential that those villages have. So we have IoT adaptation, thematically speaking, really depends on what's the source of livelihood that those villages have. We've worked with tens of startups who have existing IT solution that can be adopted in village. Interestingly, for these villages, our goal are pretty much are 2 layers of firstly is to increase their level of income and livelihood, but secondly, to also improve the quality of their life. For the first one, that's what I've mentioned. It really depends on the source of income and livelihood that villagers have in their respective villages. But the second one pretty much relate to things that needs to exist in all villages, and that comes to education and healthcare. So I think in our third level, we don't seek to sort of thematically choose which one to give, but when it comes to healthcare and education, I think it comes to essential human rights for people to have access to it. But definitely there are a lot of barriers to that as well, and we are pretty much looking forward to get back to that program and start working to improve infrastructure and literacy before we also can introduce more of this thematic services for villagers.
Okay.
Yeah, that one of the things that we already have in mind before this happened, and looking forward to continue doing that.
Yeah, cool. Mas Biondi. James, you want to add something?
Yeah, absolutely, and it's great to hear that this question, because I think it's a very interesting question, and it goes back to, you know, like when we first started our conversation with Jabbar Digital, it was completely different from what we're doing now. It was really to get that scalable access to healthcare, and you know, we are still you know, proving that that is the core of what we're doing, but really just trying to implement it in a different way. As Mas Biondi said, you know, healthcare is not a privilege. It's not a human privilege that only a select few have. It should be a fundamental right for people to actually have healthcare access. And for us, we are open and willing to work with, and happy to work with Jabbar Digital to really execute on that. How do we get healthcare access for Indonesians living, residents living in West Java, but even outside of West Java, inside of everywhere in Indonesia? That's really our end goal, and we're happy that you know, we can work with Jabbar Digital to actually make that happen.
Cool. Okay, thank you, James and Mas Biondi, and thank you, Devi, for the question. Regarding this, when health tech goes viral, James and Mas Biondi, what is strengths and weaknesses of health tech during this COVID-19 pandemic? What do you guys thinking about it?
Yeah, absolutely. So I think when we, common conception of health tech, when we think about it, is the traditional telemedicine where a doctor consults with a patient, or pharmacy delivery, or a laboratory. I think that's really what the general consensus of what healthcare, health tech is. It's a pretty broad field, but in light of telemedicine, I think definitely one of the weaknesses, as well as one of the strengths, is weaknesses that you're never going to have that patient interaction with the doctor. And I think that in itself is just irreplaceable to have technology attempt to do that. It's just very difficult, and it's hard for me to envision how that's going to happen. But I think one of the strengths that it could come out of that is you end up reaching more people, right? You essentially cut down the distance needed to actually see a doctor. And this is, I think, more relevant to people who live in the rural areas where they might have to, you know, drive an hour, or you know, take a ojek for an hour to see the doctor, because one's just not readily available. And I think if you take it a step further, how do you increase, you know, the knowledge of healthcare to these rural areas, or even areas outside of tier 1 cities? How do you do that doctor-to-doctor consultation where the specialty doctors are really saturated inside, or not really saturated, but at least huddled up in like certain clusters throughout Indonesia, where, you know, places like in Papua, they might not have a pediatric neurologist on standby, right? And so it's, how do we make this technology and leverage it as to become a strength, right? And how do we take its weaknesses and try to convert it into strengths? So I think that's definitely something I foresee for health tech.
Okay, cool. Thanks, James. Mas Biondi.
Yeah,
add something.
Yeah, definitely agree with what James has said. And to bring it to West Java context, if the ideal case is 1 per 1,000 people in terms of healthcare practitioners, doctors, nurses, In West Java context, it's 0.1 per 1,000 persons. So the number is even lower than that. We have 1.1 bed for 1,000 people, but for healthcare caregiver, we only have 0.1. It's 1/10 from ideal. So with that in mind, definitely we need to extend the reach of how people can get connected with people who can consult them. And also, I think one of the biggest upper hand with teleconsultation is the fact that people are sort of afraid of going out. There are cases where people got infected when they are in hospital. Previously, they are not infected by COVID-19, but because they got in touch with people and pretty much not aware of the situation and probably not having this personal protective equipment, there are a lot of cases where nakes, where nurses and doctors got infected as well because of the lack of PPE. So with the help of teleconsultation, I think that can even help people reduce the likelihood of getting exposed with physical interaction when they actually don't have COVID-19 to begin with. But the weakness that we might also have to concede is the fact that people also have to be truthful with the information that they are giving. So for example, when we are saying or publicly declare that we wanted to get people tested, but please let us know about your symptoms, they need to be truthful about the symptoms that they are having. If people are a bit paranoia about them might getting infected by COVID-19, they might sort of give false information just so that they can get tested, right? So there's also an element where people need to be self-aware and conscious and truthful about what they feel and their current health situation so that the doctors can sort of assess more objectively.
Oke, cool. Alright guys, wah nggak kerasa ini udah jam 5 lewat. 10 hampir. Very nice discussion with you guys. The last question we got from William Lim Kong. Apakah inovasi di bidang kesehatan dan pengobatan ini tidak terhalang peraturan atau kode etik ID atau Ikatan Dokter Indonesia or WHO? Yeah, maybe James or Mas Biondi.
Yeah, absolutely. So our engine is actually based on the WHO guidelines on how do we screen COVID. So I think that we are actually in line with it. Now, with ethics of the Doctor Association of Indonesia, we are actually trying to work with them to actually get this at least endorsed by them so that we can actually push this along, because in the end of the day, we're not trying to at the end of the day, we're just trying to get this out so that more people can get access and help out the front line.
Cool. Okay. Mas Biondi?
I think there is one issue. I'm not an expert on this, and definitely I need to get back to checking all the code ethic. But there is one issue I think that we might, I don't know, for me, I think regulation might also evolve as innovation evolves as well. I think for the moment, I don't really know, I need to check really. I think it's not allowed to give receipt if you don't have physical interaction. So probably it's also a big bottleneck as well for people sort of consulting online, but not being able to purchase specific types of drugs, for example. But we never know. Well, for me, as someone who worked for the government, it's actually human-made as well in terms of regulation, as long as there are trends that might carry out in positive direction, and there are ways to ensure that drugs that were prescribed can be responsibly monitored in its purchase and in its consumption. I think even regulation can also evolve in the future following the trend. Yeah, so that's my take for the moment. Yeah.
Wow. Okay. Okay, guys, we run out the time. It's very insightful session with you guys, Priksa and Jabar Digital Service, James and Mas Biondi. Thank you for your time, for your insightful sharing to us. Okay, guys, for all the participants, maybe we are going to take a picture together. Maybe you can turn on the video. So we can, so we can take a picture together before we closing the session. Okay, maybe my internal team, Gita, or we can, 1 second, take a picture. Okay. Yeah. Yes. Okay. Cool. 1, 2, 3. Yeah. Okay. So the picture already taken by me. Maybe my team, Agustin or Gita, can you help to just screenshot from another? Okay. Cool.
I think more people are joining. Hang on.
Yeah. Just waiting for more people. One more time, yeah. Yeah.
Yeah. Ooh, more. Okay. Any more?
Yeah.
Okay. I've taken a few.
Boleh standby senyum aja ya guys ya. Ini nggak tahu siapa yang ngambil tak.
Ada. Gua.
Ada ya. Okay.
Si Meng cantik. Okay, got it.
Okay, guys. So before we close the session, maybe James and Mas Biondi, can you give a last, statement from your side regarding this topic of the session?
Sure. I think that it's definitely unprecedented times that we're in right now, and I think the future is as bleak as it might look right now. I think it's going to be a bright future because a lot of innovation, as we discussed this past hour, is most likely going to come out of this situation. And I think that as dire as the situation looks right now, I think that there is light at the end of the tunnel. I think that when we all survive this, so we're all in it together, I think that it's only gonna make our healthcare industry in Indonesia that much stronger, that much more efficient, and that much better.
Cool. Thanks, James. Mas Biondi.
Yeah, right. Definitely self-care now is a big matter, mental health, stuff like that. So it's really important to keep positive mindset. And then also there are a lot of research out there that sort of predict when this will end. There are a lot of versions to the date or to the range of time where this will come to an end. But really, no one really knows when that will happen. But the thing is that it really depends on what we do now that matters. I think it would end sooner if all of us work together and contribute to sort of quicken or to sort of flatten the curve. And I think what we showcase here between Priksa and JDS, it's not only what the government can do, but also everyone really, be it startup partners or even individual persons, can do a bit of puzzle pieces contribution to help this come to an end as quick as possible.
Cool. Yeah. Okay, once again, thank you so much for James and Mas Biondi. Thank you for everyone who has joining us. Ada salam juga tadi dari Santos. Thank you for this great change with James and Biondi. Please pass on my regards to James and Biondi. Jadi dia tadi udah udah pergi duluan karena masih ada another appointment. Dan thank you so much untuk teman-teman yang udah join sampai habis ini ya, untuk teman-teman yang udah tanya, untuk you guys yang udah tanya. If you have any further question, you can drop me an email. I just drop my email on the Zoom group chat. And thank you so much for Priksa, for your time, Priksa team, and for JDS team, Jabar Digital Service. Hope everything goes well. And yeah, we will see you in person after this pandemic, hopefully.
Thank you also to Block 720.
Thank you so much.
I saw Agustin taking pictures. Yeah.
Thank you for taking a picture. Ya, kita bisa kirim picture-nya juga di grup chat ini ya. Thank you guys yang udah join.
Bye, have a good day.
Have a good day. Stay safe everyone ya. Bye.